Welcome back to the Am I Mental podcast, the Doctors in Court edition. My name is Dr. Sabine Fonderson, and as always, I'm excited to welcome you to another challenging case. This time, it involves a pediatric specialist and a young patient with a rare condition. This case has all the hallmarks of a complex medical drama, multiple specialists, communication breakdowns, and ultimately a complaint that led its way to court. For privacy reasons, I'll use fictional names, but the details reflect real events. This case raises questions about professional responsibility, communication among healthcare providers, and the duty of care. And it's also a great example of the unique challenges doctors face when patients and families don't fully understand who's responsible for what in their treatment. Let me set the scene. The story begins with a young boy, and I'll call him Max. He developed a swelling in his jaw. His parents were naturally concerned, and he was referred to an oral maxillar surgeon. This swelling led to a series of tests, including a CT scan and a biopsy, which confirmed a rare condition called fibrous dysplasia. And for those who may not be familiar, fibrous dysplasia is a bone disorder where a normal bone is replaced by fibrous tissue, leading to pain, swelling, and structural problems. It's a serious condition, especially when it affects the skull or facial bones, as it can impact nearby structures like the eyes and the brain. And because of this, Max was sent for further evaluation to a pediatric specialist to ensure that other parts of his body weren't affected. And the specialist, in this case, we'll call him Dr. Roberts, had to determine if Max had lesions elsewhere or any related hormonal imbalance. Dr. Roberts ordered a full body scan and some additional tests, and results showed no fibrous dysplasia outside the head, and he reassured Max's parents that there were no immediate signs of hormonal issues, and he advised them to come back in a year for a follow-up. But here's where things got complicated. Max's parents didn't fully grasp the seriousness of the condition, nor did they understand the boundaries of Dr. Roberts' role. And since the surgeon had referred them to Dr. Roberts, they thought Dr. Roberts would handle Max's overall care, including coordination with other specialists. Yet Dr. Roberts viewed his role differently. He saw himself as a consultant to rule out other issues, not as Max's primary specialist, and he assumed that the surgeon who referred him or another doctor would manage the main treatment and keep the family involved. And this communication sets the stage for future conflicts. The parents felt confused about who was in charge, and when they saw the CT report themselves, they were shocked to learn the full extent of the bone damage near Max's eye sockets, and they felt that Dr. Roberts hadn't been transparent or proactive enough in explaining the diagnosis and the next steps. The parents' complaint had several elements. First, they argued that Dr. Roberts failed to communicate fully about the diagnosis, especially not explaining that the disease extended around Max's eye sockets. They only realized this after reviewing the CT scan themselves at home. They also felt Dr. Roberts didn't take charge of coordinating care or ensuring they understood their options for treatment. They believed that Dr. Roberts should have taken a more active role, perhaps by arranging a referral to a specialized center. And finally, they were dissatisfied with his suggestion to wait a year for follow-up, feeling that this was a passive approach, and given the seriousness of the condition, they felt stranded and unsupported, also because for them it was a very anxious time. This case illustrates how gaps in communication can escalate. While Dr. Roberts thought he was clear about his role and that his work was complete, the family saw his approach as dismissive, leaving them to piece together the care plan on their own. So how did Dr. Roberts defend himself in court? He argued that he fulfilled his role based on the referral, which was to assess whether Max had any lesions outside the skull. He felt he communicated his findings clearly and accurately, believing the oral surgeon would handle the rest. Dr. Roberts explained that the scope of his responsibility was limited to the tasks outlined in the referral, and he saw his actions as consistent with this. He believed that the communication issues stemmed from misunderstandings rather than negligence. And yet the court found that Dr. Roberts didn't fully appreciate the family's expectations or take adequate steps to clarify his role. And the court determined that given the rarity and complexity of fibrous dysplasia, Dr. Roberts should have taken a more active role in communicating and ensuring the patients understood the situation. And ultimately, the court issued a formal warning to Dr. Roberts, emphasizing that specialists have a duty to clarify their role, especially when dealing with complex and rare conditions. The court highlighted that doctors should ensure families know who is coordinating care and that they understand the implications of any findings. This case touches on a fundamental issue in healthcare, the role of clear communication, especially when multiple specialists are involved. When a patient sees multiple doctors, families can easily become confused about who's responsible for what. And studies have shown that patients fare better when doctors communicate clearly and collaboratively across specialists. Other studies indicate that patients who understand their treatment plans and know who to contact for specific issues report lower stress and are less likely to pursue legal action. One study from the Journal of General Internal Medicine found that clear communication and care coordination reduce the risks of complaints and improved patient outcomes. And this is particularly true in pediatrics, where families need assurance that the child's care is in good hands. And when doctors take the time to explain roles and set expectations, patients and families feel more supported. And in complex cases, assigning a clear primary provider or care coordinator is crucial. Let me clarify a few key medical terms mentioned in this case. Fibrous dysplasia. As I discussed, this is a rare bone condition where fibrous tissue replaces bone that's normal, and it leads to weakness and deformity. This can be particularly severe in areas like the skull and facial bones. And the CT scan is a type of imaging that uses X-rays to create cross-sectional images of the body. And this scan helped to reveal the full extent of Max's condition, showing that the fibrous dysplasia extended around his eye sockets, which understandably alarmed his parents. Lastly, there's the concept of care coordination, and this refers to the organized effort to share information and coordinate actions between multiple healthcare providers, ensuring a patient's care is seamless and well managed. In this case, a lack of coordination led to confusion and ultimately to a formal complaint. Before I wrap up, let's touch on some recent empirical evidence that sheds light on the complexities of managing fibrous dysplasia, especially when it presents with craniofacial deformities, as we saw in Max's case. A 2024 study published in Curious examined a similar case in a 13-year-old girl who presented with facial asymmetry, nasal obstruction, and difficulty breathing and swallowing. The condition was diagnosed through CT imaging, which revealed a characteristic ground glass matrix in the craniofacial bones. That's a hallmark of fibrous dysplasia. This study highlights the standard approach to managing such cases, which typically involves conservative monitoring, especially if the patient isn't experiencing severe symptoms. In this case, like with Max, surgical intervention was considered a last resort and would only be necessary if there were symptomatic progression or they wanted to do it for cosmetic reasons. And this aligns with what Dr. Roberts was trying to convey in his conservative approach. And interestingly, this study emphasizes the importance of a multidisciplinary approach involving radiologists, pediatric specialists, and potential surgeons. That collaborative approach might have helped bridge the communication gaps in Max's case. It also reinforces that with rare conditions like fibrous dysplasia, a coordinated team approach is essential to ensure both medical and emotional support for the patient and their family. And the study points out the critical role of clear communication in managing patient and family expectations, which was a central issue in Max's case. When dealing with rare, complex conditions, it's vital to set up clear, ongoing communication channels to address concerns and avoid misunderstandings about roles and responsibility. So let me ask you a few questions. Number one, how could Dr. Roberts have handled communication better to ensure the family understood the extent of Max's condition and who was managing his care? Research shows that coordinated care improves patient outcomes and satisfaction. Patients who understand their treatment pathway and feel supported are less likely to seek legal action when issues arise. And question number two, if you were in Dr. Roberts' shoes, would you have made the same recommendations to wait a year for follow-up? Or would you have suggested more frequent monitoring given the rare and serious nature of fibrous dysplasia? If I were in Dr. Roberts' shoes, I would have suggested more frequent monitoring. Studies from the BMJ Open Highlight have shown that effective patient-doctor communication reduces misunderstandings and enhances trust. And in order to communicate effectively, it sometimes does take a doctor to see the patient a little bit more often than to dismiss their questions or to think that they understand it and just let it be. Ensuring patients and families understand who is responsible for each part of their care is essential, especially in multi-specialty treatment plans. Thank you for joining me for another episode of Am I Mental, the Doctors in Court edition. This case has given us much to think about regarding the importance of communication and clarity in healthcare. I hope that this discussion provides some insights into the complexities of patient care coordination. And remember, a big part of practicing medicine is helping patients feel secure, informed, and respected. Until next time, thanks for listening and keep questioning, learning, and growing.